Chapter 10. The Cardiovascular System. First, let's discuss the functions and structure of the heart. Let's begin by understanding the location and size of the heart. Take a moment to look at the figure, which illustrates where the heart lies within the body. The heart is about the size of your fist and weighs approximately 10 ounces. It is located slightly to the left side of the sternum, nestled within the chest cavity. The apex refers to the lower tip of the heart. This is the part that points downward and slightly to the left, giving the heart its distinctive shape. What is the mediastinum? The mediastinum is the region of the thoracic cavity between the lungs where the heart is located. This area also contains other vital structures, such as the trachea, esophagus, and major blood vessels. The heart is a powerful muscle with three main functions. Let's break them down. It pumps blood through all the vessels in the body, keeping everything supplied with oxygen and nutrients. Blood flows in one direction. The right side pumps blood to the lungs. The left side pumps blood to the body. What ensures this one-way flow? Answer: heart valves. The heart adjusts its force and speed to meet the body's needs, whether you're resting or active. Three simple yet essential tasks: pump, route, and regulate. That's the heart in action. The heart wall has three distinct layers. Let's explore them together. Observe this diagram. The three layers of the heart wall are endocardium and myocardium. The endocardium is the inner lining of the heart. The myocardium is the muscle layer that enables the heart to contract. The pericardium is the outer layer of the heart and serves to protect it. The pericardial cavity contains pericardial fluid, which allows the heart to pump without rubbing against adjoining structures. The pericardium has two layers: the inner visceral layer, also called the epicardium, and the outer parietal layer. These layers work together to ensure the heart functions efficiently as a muscle and protector. Let's use this figure to explore coronary circulation. The coronary circulation starts with the right and left coronary arteries. These arteries exit directly from the aorta and divide into branches. These branches supply the heart muscle with the oxygen and nutrients it needs to function efficiently. Coronary circulation is essential for the heart's health and its ability to pump blood effectively to the rest of the body. Understanding how to convert root nouns into their adjective forms is an important skill, especially in medical terminology. Let's practice by transforming these terms and defining their meanings. Change the following root nouns into their adjective forms. Answers will appear after a mouse click. Endocardium, the lining of the heart. Adjective form: endocardial. Myocardium, all the heart muscle. Adjective form: myocardial. Fibrosis, repair of dead tissue by forming fibrous tissue. Adjective form: fibrotic. Pericardium, membrane covering the heart. Adjective form: pericardial. Practice converting more terms to reinforce this concept. Being able to recognize and use these forms is critical for understanding and communicating medical information effectively. Memorizing root elements is essential for forming and understanding more complex medical terms. Let's break down some common root elements and their meanings. Here are some key root elements and their definitions. Make sure to commit these to memory for future use. Cardi, meaning heart. Viscer, meaning an organ. Cust, meaning rib. Pulmon, meaning lung. Coron, meaning crown. By mastering these root elements, you'll have the foundation to decode and construct a wide variety of medical terms. Let's explore the anatomy of the heart using this figure and understand how blood flows through this essential organ. Take a look at the figure of the heart. The heart has four chambers: right atrium, right ventricle, left atrium, left ventricle. Can you locate and identify each of these chambers on the diagram? Now, let's trace the blood flow through the heart. Blood enters the right atrium from the body through the superior and inferior vena cava. It flows into the right ventricle, which pumps it to the lungs via the pulmonary arteries. Oxygenated blood returns to the left atrium from the lungs through the pulmonary veins. Finally, It moves into the left ventricle, which pumps it out to the rest of the body through the aorta. What structures separate the heart into right and left halves? Answer: these are called the cardiac septa, which ensure proper separation and flow between the two sides of the heart. Understanding the heart's chambers and blood flow process is key to grasping how this incredible organ sustains life. Let's solidify this knowledge by labeling and explaining the diagram together. Let's explore how blood circulates through the body and the heart's role in this process. The systemic circulation supplies the body with the oxygen and nutrients needed for proper functioning. It also collects waste materials and carbon dioxide, returning them to the heart to be expelled through the lungs. This process ensures that blood is constantly refreshed and the body remains healthy. Blood flows through the heart in one direction, following a specific pathway. From right atrium, through the tricuspid valve, into the right ventricle, through the pulmonary semilunar valve, to the lungs via the pulmonary arteries, back to the heart through the pulmonary veins, into the left atrium, through the mitral bicuspid valve, into the left ventricle, through the aortic semilunar valve, out to the body. The contraction of the heart is the driving force behind blood flow. Each heartbeat pumps blood through this entire system, ensuring continuous circulation. Let's focus on the pulmonary circulation and the critical roles of the pulmonary artery and pulmonary vein in transporting blood to and from the lungs. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. Here, the blood unloads carbon dioxide and picks up fresh oxygen. The pulmonary vein brings oxygenated blood back from the lungs to the left atrium of the heart. From here, the oxygen-rich blood is distributed to the coronary vessels, which supply the heart itself, through systemic circulation, delivering oxygen to the rest of the body. Together, the pulmonary artery and vein play essential roles in maintaining the oxygen and carbon dioxide exchange that sustains life. Memorizing word elements, such as prefixes, roots, and suffixes, is a valuable tool for defining and understanding medical terminology. Let's break down an example together. Bicuspid. Prefix, bi, means to. Root, cusp, means point. Suffix, id, means pertaining to. Definition: bicuspid means having 2 points. For example, the bicuspid heart valve, also known as the mitral valve, has 2 flaps. Interatrial. Prefix, inter, means between. Root, atri, means atrium, a chamber of the heart. Suffix, al, means pertaining to. Definition: interatrial means pertaining to between the atria, referring to the area or structure located between the 2 atria of the heart. Interventricular. Prefix, inter, means between. Root, ventricle, means ventricle, a chamber of the heart. Suffix, ar, means pertaining to. Definition: interventricular means pertaining to between the ventricles, referring to the area or structure located between the 2 ventricles of the heart. By breaking words into their elements, you'll gain confidence in defining even complex medical terms. Let's practice with more examples. Let's use this figure to highlight the pacing components of the heart and understand how they coordinate its rhythm and function. Heart activity alternates between 2 phases. Systole. This is the contraction phase when blood is forced through the heart and circulatory system. Diastole. This is the relaxation phase when the heart chambers refill with blood, preparing for the next contraction. When you listen to the heart with a stethoscope, you hear lub-dub. Lub is the sound of the atrioventricular valves, tricuspid and mitral, snapping shut. Dub is the sound of the semilunar valves, aortic and pulmonary, snapping shut. The heart's rhythm is controlled by a specialized conduction system with 5 components. Sinoatrial node, or SAW node. Known as the pacemaker, it sets the heart's rhythm. Atrioventricular node, or AV node, acts as the electrical gateway to the ventricles. Bundle of His, a bundle of conduction fibers at the uppermost portion of the ventricles. Bundle branches, electrical fibers running through the ventricles. Purkinje fibers. These spread throughout the ventricular myocardium to conduct electrical impulses, ensuring coordinated contractions. The conduction system ensures that the heart beats rhythmically and effectively, pushing blood through the heart and the entire circulatory system. Let's review the figure to identify each component and reinforce their roles. Let's discuss the circulatory system. Let's use the figure to illustrate pulmonary circulation and understand the anatomy and physiology of the structures involved. Pulmonary circulation is the pathway through which blood is oxygenated in the lungs. Deoxygenated blood is carried from the right ventricle of the heart to the lungs through the pulmonary arteries. In the lungs, gas exchange occurs. Carbon dioxide is removed from the blood and exchanged for oxygen. The now oxygenated blood returns to the left atrium of the heart via the pulmonary veins, ready to be pumped out to the rest of the body. The key structures in pulmonary circulation include: right ventricle pumps deoxygenated blood into the pulmonary arteries. Pulmonary arteries transport deoxygenated blood to the lungs. Lungs contain tiny air sacs called alveoli where gas exchange occurs. Pulmonary veins carry oxygenated blood back to the heart. The lungs serve as the site of gas exchange. Carbon dioxide, a waste product, is exchanged for oxygen, which is essential for cellular energy production. Pulmonary circulation is critical for oxygenating blood and maintaining the body's energy supply. Let's review the figure to trace this process and reinforce our understanding of these structures and their roles. Let's explore the anatomy and role of the aorta, the body's main artery, and use the figure to examine the peripheral vascular system. The aorta is the largest artery in the body, originating from the left ventricle of the heart. It distributes oxygen-rich blood to all parts of the body through the systemic circulation. The aorta is divided into 4 distinct sections, each serving a specific region of the body. Ascending aorta arises from the left ventricle and supplies blood to the coronary arteries. Aortic arch curves over the heart, giving rise to major arteries that supply the head, neck, and arms. Thoracic aorta travels down through the chest, supplying blood to the chest wall and organs. Abdominal aorta extends into the abdomen, supplying blood to the digestive organs, kidneys, and lower body. Using the figure, observe how the aorta branches into smaller arteries, forming the peripheral vascular system, which ensures blood reaches every tissue in the body. Supporting structures play critical roles in blood flow, including veins carry deoxygenated blood back to the heart. Capillaries, sites of nutrient and gas exchange between blood and tissues. Arterioles and venules, small vessels that connect arteries to capillaries and capillaries to veins. The aorta and its branches, along with the supporting circulatory structures, form a highly organized network that sustains life by ensuring efficient blood distribution. To effectively build medical terminology, students must understand and define individual root elements. Let's go over some examples. Brachy/o, meaning arm. Example: brachial artery, the major blood vessel of the arm. Cephal, meaning head. Example: cephalic vein, a vein located in the head and upper arm. Poplite/e, meaning back of the knee. Example: popliteal artery, the artery located at the back of the knee. Clav, meaning clavicle. Example: clavicular, pertaining to the clavicle. Knowing these root elements makes it easier to understand and form complex medical terms. Let's practice by identifying root elements in additional terms. Let's explore the smallest blood vessels in the body and how they facilitate the exchange of nutrients, gases, and waste products. Arterioles are the smallest arteries in the body. They play a key role in regulating blood flow into the capillary system, where exchange takes place. Nutrients and gases, such as oxygen, are exchanged within the capillaries. This is where the circulatory system delivers essential substances to the tissues and picks up waste products like carbon dioxide. Venules are the smallest veins. They collect deoxygenated blood and waste products from the capillaries, returning it to larger veins and eventually back to the heart. Diffusion is the process by which these exchanges occur. It's the movement of substances from a higher level of concentration to a lower level of concentration. Oxygen and nutrients diffuse out of the capillaries into the tissues. Waste products, such as carbon dioxide, diffuse from the tissues into the capillaries. This process ensures that every cell in the body gets what it needs while waste is efficiently removed. Understanding arterioles, capillaries, and venules is key to grasping how the circulatory system sustains life. Let's explore the venous circulatory system using the figure to understand its structure and function. There are three major types of veins. Superficial veins, found near the surface of the skin. Deep veins, located deeper within the body, often running alongside arteries. Venous sinuses, specialized veins, such as those in the brain, that collect and transport blood. The inferior vena cava is the largest vein in the body. It carries deoxygenated blood from the lower body back to the heart. Veins have valves that prevent blood from flowing backward. This is especially important in fighting gravity, helping blood return to the heart. The venous system is essential for returning deoxygenated blood to the heart. Let's use the figure to identify these key structures and reinforce their functions. Knowing medical terminology helps students identify where structures are located in the body. Let's apply this knowledge to some key blood vessels. Axillary artery, found under the arm, supplies blood to the upper limb. Femoral vein, found in the groin, returns deoxygenated blood from the lower limb to the heart. Saphenous artery, found in the thigh, supplies oxygenated blood to the lower limb. Brachial vein, found in the upper arm, drains deoxygenated blood from the arm. Understanding the terminology not only helps locate these vessels, but also provides clues about their function and connection to the circulatory system. Let's practice with more examples to reinforce this concept. Let's explore the structure and function of blood vessels, focusing on their layers, how they regulate blood flow, and the unique characteristics of veins. Blood vessels have three distinct layers. Tunica intima, the innermost layer, providing a smooth surface for blood to flow. Tunica media, the middle layer, made of muscle, which controls vessel diameter. Tunica adventitia, the outermost layer, providing structural support and protection. What's the difference between these two processes? Vasodilation, the relaxation or widening of blood vessels, increasing blood flow. Vasoconstriction, the contraction or narrowing of blood vessels, reducing blood flow. Which blood vessels contain valves to ensure blood flows in one direction? Veins. Valves in veins prevent backflow, especially when blood is moving against gravity, such as from the legs to the heart. Understanding these features helps explain how blood vessels maintain proper circulation and adapt to the body's needs. Let's review these concepts further with the figure. Let's discuss how blood circulates, the role of gravity, and how we measure blood pressure. Gravity naturally helps circulate blood, particularly in standing or sitting positions. However, in microgravity environments like space, astronauts wear special units that assist in pumping blood back into circulation from the tissues to prevent pooling and maintain proper blood flow. The easiest pulses to palpate are radial artery, located at the wrist, commonly used for pulse checks. Brachial artery, found at the elbow, often used when taking blood pressure. Blood pressure is the force exerted by blood on the walls of arteries as it circulates. It's a critical measure of cardiovascular health. The instrument used to measure blood pressure is the sphygmomanometer, which provides readings of systolic and diastolic pressures. Understanding circulation, pulse points, and blood pressure is essential for evaluating and supporting cardiovascular health. Let's practice locating pulses and using a sphygmomanometer to reinforce these concepts. To effectively build and understand medical terminology, students must become familiar with root elements. Let's define some key roots that are frequently used. Pedi, meaning foot. Example, pediatrician, a doctor specializing in children. derived from the Greek word for child and foot. Radi, meaning radius. Example, radiology, a medical specialty focused on imaging techniques, often involving the radius or surrounding areas. Dilate, meaning open up. Example, dilation, the act of expanding or opening, as in blood vessels or body passages. Vaso, meaning vessel. Example, vasoconstriction, the narrowing of blood vessels, reducing blood flow. Understanding these root elements will help you decode complex terms and better grasp their meanings. Let's practice forming medical terms using these roots. Here we will overview disorders of the heart and circulatory system. Arrhythmias are irregularities in the heart's rhythm that can range from harmless to life-threatening. Let's discuss the 4 commonly seen types of arrhythmias and their characteristics. Premature beats often feel like the heart skipped a beat and are typically associated with caffeine or stress. These are generally harmless but can feel unsettling. Atrial fibrillation, or AFib, occurs when the atria quiver instead of contracting properly. This can lead to blood pooling in the atrium, increasing the risk of clot formation. Paroxysmal atrial tachycardia, characterized by rapid, regular heartbeats ranging from 160 to 200 beats per minute. It starts and stops abruptly, often catching people off guard. This involves an irregular heart rate originating in the ventricles. Can anyone identify some ventricular disorders? Examples include ventricular tachycardia, premature ventricular contractions, and ventricular fibrillation. Heart block is an interference in the electrical conduction system of the heart. This prevents coordination between the atrial and ventricular contractions, disrupting normal heart function. Palpitations are unpleasant sensations of a rapid or irregular heartbeat. They can last a few seconds or minutes and are often noticed during periods of stress or exertion. Understanding these arrhythmias is critical for recognizing potential cardiac issues. Let's review examples of each and discuss how they affect the heart's rhythm and overall function. The heart's rhythm and rate provide critical insights into its function. Let's discuss normal heart rates, deviations like tachycardia and bradycardia, and how these look on an EKG. A normal heart rate is 60 to 80 beats per minute, reflecting the heart's regular and efficient pumping action. Tachycardia is when the heart rate exceeds 100 beats per minute. It can result from stress, exercise, or medical conditions. On an EKG, tachycardia appears as rapid, closely spaced waves. Bradycardia is when the heart rate drops below 60 beats per minute. This may occur in highly trained athletes or as a result of medical conditions. On an EKG, bradycardia shows as widely spaced waves. An arrhythmia or dysrhythmia refers to any abnormal heart rhythm. These can range from minor irregularities to severe disruptions that require medical attention. Let's use the figures to compare what tachycardia and bradycardia look like on an EKG and identify the differences from a normal rhythm. Understanding heart rates and rhythms, including how to interpret EKG readings, is a vital skill for recognizing potential heart issues. To strengthen your understanding of medical terminology, it's important to recognize terms based on their definitions. Let's practice with some examples. Occurring in sharp, spasmodic episodes. Term, paroxysmal, uncontrolled quivering of the heart. Term, fibrillation, forcible, rapid beat of the heart felt by the patient. Term, palpitation. Now, match these definitions with their terms. Occurring in sharp, spasmodic episodes. Uncontrolled quivering of the heart. Forcible, rapid beat of the heart felt by the patient. Understanding these definitions and their corresponding terms will help you interpret medical scenarios and communicate effectively. Let's practice with more terms. Heart valves play a critical role in maintaining one-way blood flow through the heart. Let's use the figure to locate and review the heart valves and discuss common disorders associated with them. The heart has 4 valves, each ensuring blood flows in the correct direction. Tricuspid valve is located between the right atrium and right ventricle. Pulmonary valve is located between the right ventricle and pulmonary artery. Mitral valve, or bicuspid, is located between the left atrium and left ventricle. Aortic valve is located between the left ventricle and the aorta. Heart valves can malfunction in two main ways: stenosis and incompetence. Stenosis is where valve does not open fully, restricting blood flow. Incompetence, or regurgitation, is where the valve does not close fully, allowing blood to flow backward. Common valve disorders include mitral valve and aortic valve incompetence. Commonly occurs in the elderly due to age-related calcification. Mitral valve incompetence, also known as mitral regurgitation, occurs when the mitral valve does not close properly. This causes blood to flow backward from the left ventricle into the left atrium during ventricular contraction. Aortic valve incompetence, also known as aortic regurgitation, occurs when the aortic valve does not close properly. This causes blood to flow backward from the aorta into the left ventricle during diastole. Rheumatic fever is an inflammatory disease caused by untreated group A beta hemolytic streptococcus infections, such as strep throat. It can cause long-term damage to the heart valves, particularly the mitral and aortic valves. Understanding the anatomy and disorders of heart valves is crucial for diagnosing and managing cardiovascular diseases. Let's review the figure to reinforce these concepts. Heart conditions can affect various layers and functions of the heart. Let's explore the populations at risk, the impact of inflammation, and specific disorders affecting the heart. Endocarditis is an infection of the inner lining of the heart. At-risk populations include 4 drug users and individuals with damaged heart valves. Myocarditis is the inflammation of the heart muscle itself, which can disrupt the heart's ability to pump effectively. Pericarditis is an inflammation of the membrane surrounding the heart. It interferes with the heart's ability to fully contract, limiting its efficiency. Cardiomyopathy is defined as a weakening of the heart muscle that reduces its ability to pump blood effectively. This condition often leads to heart failure if untreated. Cor pulmonale is the failure of the right ventricle to pump blood properly. It is often caused by increased pressure in the lungs due to chronic respiratory conditions. Understanding these conditions helps identify risk factors and recognize how they disrupt the heart structure and function. Let's review these topics with the figure to reinforce these key points. By understanding the definitions of medical terms, students can make meaningful associations and better comprehend related conditions or processes. Let's explore 2 examples. Example 1. Pericarditis and tamponade. What do these terms have in common? Pericarditis, inflammation of the pericardium, the sac surrounding the heart, often leads to an accumulation of fluid. This fluid buildup can compress the heart, resulting in a condition known as tamponade. Both terms describe issues arising from the interaction between the heart and the pericardial sac. Example 2. Valve dysfunction, incompetence, insufficiency, and regurgitation. What do these terms have in common? Incompetence, insufficiency, and regurgitate all describe a valve that fails to close completely. This dysfunction allows blood to flow backward, or regurgitate, into the chamber it came from. These terms are used interchangeably to describe the same underlying issue with valve function. By making associations like these, you can understand how terms are related and how they describe specific physiological or pathological processes. Let's apply this approach to more terms on the slide. Let's discuss critical heart conditions and emergencies, focusing on their symptoms, causes, and implications. Angina pectoris is chest pain that occurs during exertion. It is typically the first symptom of reduced oxygen supply and blood flow to the myocardium, indicating a potential heart issue. What is a myocardial infarction? It is the death of heart tissue caused by the occlusion of coronary arteries, which blocks oxygen and nutrient supply to the myocardium. Cardiogenic shock occurs when the heart is unable to pump enough blood to meet the body's needs. Symptoms include weak, rapid pulse, decreased blood pressure, pale, cold, sweaty, and anxious appearance. Asystole, often referred to as a flat line, indicates that the heart is in cardiac arrest with no electrical or muscular activity. This is a life-threatening emergency requiring immediate intervention. What is ischemia? Ischemia refers to the lack of blood supply to a tissue, resulting in oxygen deprivation and impaired function. Understanding these conditions and their symptoms is critical for recognizing and responding to heart-related emergencies. Let's review these points and discuss scenarios where they might apply. Coronary artery disease is a leading cause of heart-related issues. Let's explore how it develops, its risk factors, and how lifestyle changes can reduce the risk. Arteries become narrowed by plaque deposits called atheromas. Use the figure to compare a normal artery with one that has plaque deposits. When plaque builds up inside an arterial wall, blood flow is reduced. In the coronary arteries, this narrowing means reduced blood flow to the heart muscle, limiting oxygen and nutrients. Let's list the risk factors for developing coronary artery disease. Obesity, lack of exercise, tobacco use, diabetes mellitus, high blood pressure, high cholesterol, stress. All of these risk factors can be reduced by making lifestyle changes. Ask yourselves, what lifestyle changes can help reduce the risk of coronary artery disease? Possible answers include maintaining a healthy weight, exercising regularly, quitting smoking, managing diabetes effectively, controlling blood pressure and cholesterol, managing stress through techniques like meditation or therapy, eating a heart-healthy diet, rich in fruits, vegetables, and lean proteins. Understanding coronary artery disease, its risk factors, and the role of lifestyle changes empowers us to take control of heart health. Let's discuss specific strategies you can apply in your daily lives. Let's solidify our understanding of key terms related to heart disorders. By now, students should be able to explain the differences between commonly confused terms. Occlude refers to a blockage in a blood vessel, preventing blood flow. Perfuse refers to free-flowing blood, ensuring tissues receive oxygen and nutrients. Think of occlude as a problem and perfuse as the desired condition. Arteriosclerosis is a broad term that describes any hardening or stiffening of the arteries. Atherosclerosis is a specific form of arteriosclerosis caused by plaque buildup within the arterial walls, leading to narrowing and reduced blood flow. While all atherosclerosis is arteriosclerosis, not all arteriosclerosis is atherosclerosis. These distinctions are critical for understanding heart disorders and their implications. Let's review these terms with examples and discuss how they apply in real-world scenarios. Hypertension, or high blood pressure, affects approximately 20% of the adult population. Let's explore the four main types of hypertension, their characteristics, and associated risk factors. Primary or essential hypertension. The etiology of this type is unknown, but the risk factors are well documented. What are the risk factors? Overweight, tobacco use, stress, lack of exercise, excessive alcohol consumption. Secondary hypertension. This type of hypertension results from other underlying diseases, such as kidney disease, hypothyroidism, adrenal disorders, malignant hypertension. This is a severe and life-threatening form of hypertension. It can lead to multiple organ failure if not treated promptly. Rehypertension. Rehypertension serves as a warning sign and is defined by systolic pressure below 139 mmHg, diastolic pressure between 80 and 90 mmHg. It indicates a need for lifestyle changes to prevent progression to full-blown hypertension. Understanding the types of hypertension and their risk factors is essential for prevention and management. Let's discuss ways to address these risk factors and review the figure for a deeper understanding. Let's explore congestive heart failure and common congenital heart defects, focusing on their causes, symptoms, and key characteristics. Congestive heart failure is the inability of the heart to supply enough cardiac output to meet the body's metabolic needs. Common causes include cardiac ischemia, cardiomyopathy, chronic lung disease, valvular regurgitation, severe hypertension, aortic stenosis. Symptoms: shortness of breath, orthopnea. Now, let's discuss congenital heart defects and the various types. Atrial septal defect occurs where blood flows abnormally from the left atrium to the right atrium due to a hole in the atrial septum. Ventricular septal defect occurs where blood flows from the left ventricle to the right ventricle, caused by a hole in the ventricular septum. Patent ductus arteriosus occurs when an artery that normally closes after birth remains open longer than 24 hours. This creates higher pressure in the lungs, which can lead to damage. Coarctation of the aorta is a narrowing of the aorta, occurring shortly after the artery to the left arm branches off. It restricts blood flow and increases workload on the heart. Tetralogy of Fallot is a syndrome involving 4 congenital heart defects, which include pulmonary stenosis, ventricular septal defect, overriding aorta, right ventricular hypertrophy. Surgical repair is required to correct these defects. Understanding these conditions helps identify their symptoms and long-term impacts on cardiovascular health. Vein disorders can affect circulation and lead to discomfort or more serious complications. Let's explore common conditions and related terms. Phlebitis refers to an inflammation of a vein, often causing pain and swelling. Thrombophlebitis is the inflammation of the lining of a vein, typically associated with the formation of a blood clot within the vein. Deep vein thrombosis is a serious condition caused by blood clots forming in deep veins. Common causes include immobility, surgery, prolonged travel, contraception using estrogen. Varicose veins are veins that have lost their elasticity, causing them to become swollen, painful, and often visible under the skin. Use the figure to illustrate what varicose veins look like and their common locations. What is the job title of a person who draws blood? Phlebotomist, a professional trained to draw blood for medical testing, transfusions, or donations. Understanding vein disorders and their causes helps in prevention and management. Peripheral vascular disease encompasses a wide range of disorders affecting the arteries and veins in the systemic circulation. Let's explore its definition and key related conditions. Peripheral vascular disease, or PVD, is a general term describing all disorders of the systemic arterial and venous systems. It often involves reduced blood flow due to narrowing, blockage, or damage to vessels. An aneurysm is a dilation of an artery caused by a weakness in the vessel wall. An intracranial aneurysm can lead to bleeding in the brain, resulting in serious complications, including a stroke. Thromboangiitis obliterans is an inflammatory disease of the arteries, often leading to clot formation. It typically affects the legs, causing pain, reduced blood flow, and tissue damage. Carotid artery disease affects the 2 major arteries supplying blood to the brain. When these arteries are blocked or narrowed, the patient is at risk for a stroke, as the brain's oxygen supply is compromised. Understanding these vascular conditions highlights the importance of early detection and management to prevent serious complications like stroke or tissue damage. Let's review the figure to identify these key conditions and their effects. To build a strong medical vocabulary, it's essential to understand root elements. Let's define some commonly used root elements and their meanings. Meaning clot. Example: thrombosis, the formation of a blood clot in a blood vessel. Peripher, meaning outer part. Example: peripheral, relating to or situated on the edge or outer part of a system or structure. Phleb, meaning vein. Example: phlebitis, inflammation of a vein. Clotic, meaning limping. Example: claudication, pain and limping caused by inadequate blood flow to muscles. Embol, meaning plug. Example: embolism, the sudden blockage of a blood vessel by a plug, such as a blood clot or air bubble. Understanding these root elements helps decode complex medical terms and improves your ability to communicate and interpret medical information. Let's discuss procedures and pharmacology pertaining to the cardiovascular system. Let's discuss key diagnostic tests used to assess cardiovascular health and identify conditions like coronary artery disease, CAD, and myocardial infarction, MI. The lipid profile measures total cholesterol, HDL, or high-density lipoprotein, often called the good cholesterol because it helps remove excess cholesterol from the bloodstream. LDL, or low-density lipoprotein, known as the bad cholesterol because it contributes to plaque buildup in arteries. Triglycerides, another type of fat in the blood linked to heart disease. B-type natriuretic peptide, or BNP, is a hormone released by the brain. It is often used to assess heart failure severity and monitor treatment effectiveness. C-reactive protein, or CRP, is a marker of inflammation. When elevated, it has been identified as a risk factor for atherosclerosis and CAD. Homocysteine is an amino acid in the blood. Elevated levels are associated with a higher risk of CAD and stroke, highlighting the importance of monitoring this biomarker. Creatine kinase is an enzyme released by dead myocardial cells during a myocardial infarction, heart attack. Elevated CK levels indicate cardiac muscle damage. Troponin I and T are proteins released into the blood during a myocardial infarction. These are highly specific markers for diagnosing heart attacks and assessing the extent of heart damage. Understanding these diagnostic tests and their significance is essential for identifying and managing cardiovascular conditions. Diagnostic tests are crucial for assessing cardiac function and identifying potential heart conditions. Let's explore some key tests, their methods, and their purposes. Auscultation involves listening to the heart and lungs with a stethoscope. This can reveal abnormal heart sounds, murmurs, or irregular rhythms. The electrocardiogram, or ECG, picks up electrical currents in the heart muscle, providing insight into heart rhythm, electrical conduction, and potential issues like arrhythmias or ischemia. Cardiac stress testing measures heart function under increased demand. Typically involves exercise, such as walking or running on a treadmill. Monitors heart rate, rhythm, and blood pressure during physical activity. The Holter monitor provides a continuous ECG recorded on a digital device over 24 to 48 hours. This test captures heart activity during your daily routine, making it useful for detecting intermittent arrhythmias. For individuals unable to perform physical exercise, this test combines nuclear imaging with a drug like Persantini, which increases the heart's demand as well as helps to assess blood flow to the heart muscle. Echocardiography uses ultrasound waves to study the heart's structure and function at rest. It provides detailed images of heart chambers, valves, and blood flow patterns. These diagnostic tests offer valuable insights into cardiac health, helping to diagnose conditions and guide treatment decisions. Today, we'll discuss advanced diagnostic tests and imaging techniques that provide detailed insights into heart anatomy, function, and potential abnormalities. Transesophageal echocardiography, or T, involves the insertion of a small probe into the esophagus. Records the anatomy and function of heart valves with enhanced clarity due to its proximity to the heart. Event monitoring, used for patients whose symptoms occur sporadically. Records heart activity only during reported events, such as palpitations or irregular heartbeats. Blood pressure monitor, provides a record of blood pressure trends over time. Useful for diagnosing hypertension and assessing treatment effectiveness. Electron beam therapy, a specialized scan to identify calcium deposits in arteries, which may indicate atherosclerosis. Cardiac catheterization. A thin tube is guided into the heart to measure patterns of pressures and blood flow, often combined with other procedures for comprehensive evaluation. Coronary angiogram, performed during cardiac catheterization, utilizing contrast dye to visualize coronary arteries and detect blockages. Hohmann's sign, a quick clinical evaluation used to check for the presence of a deep vein thrombosis, DVT. Venogram, an X-ray of a vein, often performed with contrast dye to highlight vein structure and detect blockages or clots. Colored Doppler ultrasonography, uses high-frequency sound waves to evaluate cardiac valve function, rates of blood flow through the heart and vessels. CT scan and MRI, Both provide detailed images of the heart anatomy, offering insights into structure and potential abnormalities. These advanced tools are critical for diagnosing and managing complex heart conditions. Let's discuss advanced procedures used to treat blocked or damaged blood vessels and restore proper blood flow, focusing on how each technique works and its purpose. Thrombolysis involves injecting medication designed to dissolve a clot in a blocked vessel. The clot dissolves, reopening the blocked vessel and restoring blood flow. Percutaneous transluminal coronary angioplasty, PTCA. Here, a balloon is inserted into the plaque-filled vessel. The balloon inflates, compressing the plaque against the vessel wall, restoring blood flow by widening the narrowed vessel. Stent placement. A stent is a small device placed within the vessel to prop it open that keeps the vessel open and ensures sustained blood flow. Angioplasty laser. A catheter with a laser tip is used to break down blockages in the artery and opens the blocked artery to restore circulation. Atherectomy involves removing plaque buildup from inside a blood vessel using a specialized device. This improves blood flow by physically clearing the blockage. Coronary artery bypass graft, or CABG. A blocked coronary artery is bypassed using either live tissue, such as veins from the leg, or arteries from the chest. Artificial graft material reroutes blood flow around the blockage to supply the heart muscle. Heart transplant is for replacing a damaged or failing heart with a donor heart. Tissue matching must be performed before the transplant to minimize rejection risks. Outcome of this procedure is to restore cardiac function in patients with end-stage heart failure. These procedures demonstrate the range of innovative techniques available to manage and treat vascular and cardiac conditions effectively. Let's discuss various treatments and devices used to manage cardiac rhythm disorders and valve replacements. Each plays a critical role in restoring or supporting heart function. Cardioversion converts the heart's arrhythmia back into a normal rhythm using electrical or chemical means. Radiofrequency ablation destroys heart cells causing abnormal rhythms using radiofrequency energy, effectively eliminating the source of arrhythmias. Pacemakers help regulate the heartbeat and can be set to assist only when needed or operate continuously to override the patient's natural rhythm. Implantable cardioverter/defibrillator, or ICD, delivers a small electric shock to the heart during fibrillation, restoring the heart's rhythm to normal. Automatic external defibrillator, or AED, device placed on the chest to deliver a shock and restore the heart to a regular rhythm. There are two types of valve used for replacement: mechanical and tissue. Mechanical valves are made from durable materials such as metal alloys and plastic. These devices are long-lasting but require lifelong anticoagulation therapy. Tissue valves can come from a pig, a cow, or a human donor. Additionally, tissue from the patient's own pericardium can be surgically crafted into a valve. This tends to have a more natural function, but may need replacement over time. Understanding these treatments and devices helps us appreciate the innovations in managing cardiac conditions. Let's discuss the treatment options for strokes and peripheral vascular disorders, including the role of lifestyle changes in managing vascular health. Ischemic stroke caused by a blood clot or other obstruction in an artery supplying the brain. Treatments include thrombolytic therapy. Medications like tissue plasminogen activator are used to dissolve clots. Mechanical thrombectomy, a procedure to physically remove the clot using a catheter. Anticoagulants or antiplatelets, to prevent further clots. Hemorrhagic stroke, caused by bleeding in the brain due to a ruptured blood vessel. Treatments include surgery, to repair the ruptured vessel or remove the accumulated blood. Coil embolization, inserting a coil to block blood flow to the ruptured area. Blood pressure control, to reduce further risk of bleeding. Varicose veins are enlarged, twisted, and swollen veins, usually in the legs, caused by weakened or damaged valves that allow blood to pool. Treatments include sclerotherapy, injection of a solution to collapse the vein. Laser therapy, to seal the vein and reroute blood flow to healthier veins. Vein stripping, surgical removal of varicose veins in severe cases. Also lifestyle changes, such as elevating legs, wearing compression stockings, and staying physically active can help alleviate symptoms. Venous stenosis is the abnormal narrowing of a vein, which restricts blood flow and can lead to swelling, pain, or impaired circulation. Treatments include angioplasty, widening narrowed veins using a balloon or stent. Bypass surgery, rerouting blood flow around the stenosed vein. Also, lifestyle changes, such as maintaining healthy weight and controlling conditions like diabetes and hypertension, can reduce progression. Impact of lifestyle changes on the peripheral vascular system can prolong the progression of the disease. These can include changes in diet, exercise, smoking cessation, and weight management. For diet, a heart-healthy diet rich in fruits, vegetables, and whole grains reduces cholesterol and improves circulation. For exercise, regular activity strengthens vessels and improves blood flow. Smoking cessation prevents further damage to blood vessels, as well as weight management reduces strain on the vascular system. Cardiovascular drugs are essential tools for managing heart and vascular diseases. Let's review the main classes of these medications and their functions. Beta blockers. Action: reduce heart rate and contractility by blocking the effects of adrenaline on beta receptors. Use: treat hypertension, arrhythmias, angina, and heart failure. ACE inhibitors, or angiotensin-converting enzyme inhibitors. Action: prevent the formation of angiotensin II, a chemical that narrows blood vessels, leading to lower blood pressure. Use: manage hypertension, heart failure, and reduce the risk of stroke and heart attack. Angiotensin receptor blockers. Action: block the receptors for angiotensin II, relaxing blood vessels and lowering blood pressure. Use: treat hypertension and heart failure, particularly in patients intolerant to ACE inhibitors. Calcium channel blockers. Action: prevent calcium from entering heart and blood vessel walls, reducing contractility and causing vasodilation. Use: treat hypertension, arrhythmias, and angina. Cholesterol-lowering drugs. Action: reduce cholesterol levels in the blood, particularly LDL, or low-density lipoprotein. Use: lower the risk of atherosclerosis, coronary artery disease, and stroke. Examples: statins, fibrates, and bile acid sequestrants. Other cardiovascular drugs include specialized medications like antiarrhythmics and vasodilators to target specific cardiac conditions. Chrono/eno/dromotropic drugs. Chronotropic drugs affect the heart rate. Inotropic drugs alter the force of heart contractions. Dromotropic drugs influence the speed of electrical conduction in the heart. Use: manage arrhythmias, heart failure, and cardiac output. Anticoagulants. Action: prevent blood clots by inhibiting clotting factors. Use: treat or prevent conditions like deep vein thrombosis, pulmonary embolism, and atrial fibrillation. Examples: warfarin, heparin, and newer oral anticoagulants. Diuretics. Action: increase urine production to reduce fluid retention and lower blood pressure. Use: manage hypertension, heart failure, and edema. Types: thiazide diuretics, common for hypertension. Loop diuretics, used in acute fluid overload situations. Potassium-sparing diuretics, prevent potassium loss while treating fluid retention. To effectively understand and manage cardiovascular conditions, students must become familiar with the classifications and actions of common cardiac medications. Let's define the actions of key drug categories. Anticoagulants. Action: prevent blood clotting or reduce the incidence of blood clots. Use: treat or prevent conditions such as deep vein thrombosis, pulmonary embolism, and atrial fibrillation. Diuretics. Action: increase urine output to reduce fluid volume in the circulatory system. Use: Manage hypertension, heart failure, and conditions involving edema. Chronotropic drugs. Action. Alter the heart rate. Positive chronotropic drugs increase heart rate. Negative chronotropic drugs decrease heart rate. Use. Manage conditions like bradycardia or tachycardia. Antiarrhythmics. Action. Restore a normal heart rate and rhythm. Use. Treat arrhythmias such as atrial fibrillation, ventricular tachycardia, or premature ventricular contractions. Inotropic drugs. Action. Control the strength of the heart's contraction. Positive inotropes. Strengthen the force of contraction. Negative inotropes. Reduce contraction force. Use. Manage heart failure and support cardiac output. Vasodilators. Action. Relax smooth muscle and arteries, increasing blood flow and reducing blood pressure. Use. Treat hypertension, angina, and heart failure. Being able to identify opposite meanings of medical terms is an important skill. Let's explore some commonly confused terms and their differences. Bradycardia, a heart rate below 60 beats per minute, indicating a slower than normal rhythm. Tachycardia, a heart rate above 100 beats per minute, indicating a faster than normal rhythm. Sinus rhythm, the normal heart rhythm, originating from the sinoatrial node. Arrhythmia, an abnormal heart rhythm, which may include irregular, too slow, or too fast beats. Systole refers to the contraction of the heart, during which blood is pumped out to the body and lungs. Diastole refers to the relaxation phase, during which the heart chambers refill with blood. Understanding medical abbreviations is critical for communication in healthcare. Let's define some commonly used abbreviations and their meanings. AED, automatic external defibrillator, a portable device used to restore a normal heart rhythm during sudden cardiac arrest. ICD, implantable cardioverter/defibrillator, a device implanted in the chest to correct dangerous heart arrhythmias by delivering shocks. Paroxysmal atrial tachycardia, sudden episodes of rapid heart rate originating in the atria. PVC, premature ventricular contraction, an early heartbeat originating in the ventricles, often described as a skipped beat. VIB, ventricular fibrillation, a life-threatening heart rhythm where the ventricles quiver instead of pumping blood effectively. CHF, congestive heart failure, a condition where the heart cannot pump enough blood to meet the body's needs. CPR, cardiopulmonary resuscitation, a life-saving technique combining chest compressions and artificial ventilation to maintain blood flow and breathing. CVT, cardiovascular technician, a healthcare professional who assists with diagnostic tests like ECGs and stress tests. CG/EKG, Electrocardiogram, a test that measures the electrical activity of the heart. SOB, shortness of breath or short of breath, difficulty breathing, a common symptom in heart or lung conditions. STAT, immediately, a directive to perform an action as quickly as possible in medical settings. To effectively build and understand medical terms, students must grasp the meaning of suffix elements. Let's define some common suffixes and their meanings. Ion, meaning, process. Example, contraction, the process of contracting. IC, meaning, pertaining to. Example, cardiac pertaining to the heart. Plasty, meaning, formation, often surgical repair or reshaping. Example, angioplasty, surgical formation or repair of a blood vessel. Tropic, meaning, change. Example, chronotropic pertaining to a change in heart rate.